Hello, everybody. My name is Lulu Achua, and today I'm going to be talking about the various routes of medication administration. Before you administer a medication, you have to do the what I call the three-step process in confirming and checking the medication before administering it. These three steps include you check the medication to make sure it's a proper medication before you remove it from the drawer. That's you check it with your MA or EMA, depending on what system you are using. You when placing the medication in a medication cup, in the syringe, or administrative device, you check again the medication, and before administering the medication to the client, you have to cross-check again. That makes it 3 times. So when this is done, then now I provide my privacy to the patients. I do hand hygiene by washing my hands with soap and water. I introduce myself to the patient and explain the procedures to the patient. I gather my supplies. The supplies can be the spoon, medication spoon, it can be applesauce, it can be yogurt, it can be water, or a cup for water or for juice, depending on what the patient uses. And then I'll do the 2-step identifier to identify the patient. So in this process, I ask the patient to tell me their name and first and last name and the date of birth. While they do that, I confirm with their name band to make sure I'm working with the right patient. When all this is done, I have to also complete a check to make sure the person does not have any allergy to any of the medications that I'm about to administer. I review the patient's labs. I check on the physical assessment. I make sure the person has can be able to swallow if it's a medication that is being administered orally. After that, I follow the 6 rights of documentation, which is making sure I'm giving the right medication at the right time, the right dose to the right person. The right route and documentation, which is the key. Documentation is always there, it has to be there. And when all that is done, I have to educate the patient on the name of the medication, the possible side effects of the medication, the purpose for which they are receiving the medication. Some of them may not know because they just feel that as a healthcare personnel, you know what is good for them, that's why you're giving them. But they have the right to know what they're taking, why they're taking it, and how often they're supposed to take it. So that is my job as a nurse, to educate the patient on that. And when all that is done, I make sure I document accordingly. There are different types of medication administration, different types or different routes. It can be orally. A medication that is administered orally, I should make sure it is being done properly and appropriately. I have to verbalize the different ways to the person. I have to make sure I let the person know that there are different ways in which they can take medication, but for their purpose, or I tell them what they are taking and why they are taking that route. Either it's orally, or it's through a liquid syringe or a liquid cup, or they're using a crush, or they have a crush order, or they are taking it whole in applesauce, or they're using orange juice or water. So I have to be sure I explain all of that. I know all of that and know what to do or which ones to give to the person. And they also a topical medication administration, which is I have to make sure if it's a topical medication, I make sure I clean the skin. I rotate the sites for if it's for patches, and I date put a date, time, and my initial on the patch so that the next person knows when it was administered, when it's supposed to be removed, and who administered the last one. And I make sure I use gloves. I remove all patches before administering new ones, so that I'm not double dosing or overdosing the patient, because the old patches still have some potency of the medication in it. So make sure you remove the old patches before applying new ones. Make sure you have your gloves on, and when all those ones are done, I have to go now to the next route, which is the nasal. When administering nasal medication, check the names for it. Make sure I check for for irritation. I check I clear passages, occlude one nose tree, no blowing. The patient should not blow nose for several minutes after medication is being administered, and that is a patient education that I also have to tell the patient, that after administering this medication, you will not blow your nose for, let's say, 5 minutes, 10 minutes, depending on what kind of nasal medication they are taking. There are also oral inhalers, which are I make sure I administer it properly. When this is done, I also make sure the patient rinse their mouth after oral medication. And oral medications, if they are more than one, there should be an interval of 5 minutes between each medication, just like with the eye drops. If it is an eye drop and the person has more than one eye drop, there should be an interval. Let's say the person has 3 eye drops to take. There should be a difference of 2 minutes between the first and the second eye drop, and 5 minutes between the second and the third eye drop. So when all this is done, proper medication has been given to the right medication has been given to the right patient at the right route at the right time, the right dose, and documentation follows. In a procedure where I had gloves on, make sure after administering the medication, I undo my gloves, I wash my hands before documenting, and I'll also explain to the patient the procedures as well. Thank you.